Right. Good afternoon, everybody. It's an honor to be presenting, and I congratulate NCEARD for addressing this particular topic of COVID, specifically in perspective to elderly. So all my previous speakers have already talked about aging, elderly, then the statistics and nutritional requirements, and of course, what is the NGO perspective in all specific services which are being already provided to the elderly in various pockets of the country. Now, my talk is basically going to focus on the national perspective. I'm heading the National Program for Healthcare of Elderly in the country. So being a program manager and also from the Ministry of Health and Family Welfare, our perspective has to look at all elderly in the country, be it rich, poor, be it in the slum area, be it in the urban area, be it gender specific, whatever. So basically in COVID, what we have come to understand is that elderly require certain things, program specific or non-program specific, across the country. So when this COVID infection started, the ministry was faced with a big challenge that you need to strategize and prioritize certain things for control as well as for prevention at the national level. So I'll be basically focusing on that and not going into the specifics of what elderly are going through presently. Now, why focus on the elderly population? All my previous speakers have given you a lot of statistics. I'm going to just say one thing, that as far as Census 2011 is concerned, 10.4 crores of elderly, with approximately 75% reporting at least one chronic illness. Dr. Arakuswamy and previous speakers have already given you the spectrum of chronic illnesses that have been identified or have been reported by elderly. So there are no two questions about it that yes, chronic illness per se is present in most of the elderly. Now, elderly people more than 60 years of age are at a very higher risk of COVID-19 infections, primarily due to decreased immunity, decreased body reserves, and multiple associated comorbidities. I'm mentioning only 4 out here because these are the ones which have been found very closely associated and which have been actually reported and diagnosed in most of the elderly. Second important component is that even if they get COVID, they have the highest risk of developing severe illness the fastest way. So that is another issue. COVID-19 in elderly has got variable presentation. Mostly they could be asymptomatic, or it could be an exacerbation of pre-existing symptoms or disease or any chronic illness that they already have, or they could have unusual presentations, like you could have a normal elderly who could be a hypertensive diabetic. So we are looking at only heart kind of symptoms. But the person could present with just plain confusion state, delirium state. It could be just a low-grade fever which is just continuing and there is absolutely lack of appetite. Next, please. So one very important thing which you have to understand with elderly across the country, what we have received as reports, is that there can be any kind of presentation for the elderly. Secondly, physical distancing and challenges of accessing healthcare, which Matthew had already stated. These lead to more complications, even with multiple chronic conditions. So even if you don't contract COVID-19, you are being addressed with certain nutrition-related issues, mental or psychosocial issues because of being cooped up in the house. They are also particularly at risk for social isolation, loneliness, and lack of access to food and medications. at this particular time. Now, by social isolation, one very important factor which some of the people have reported to me from the various states is that you may be sitting inside the house. You may not be actually alone. You may be inside the house with family, but you may be feeling lonely and you may not share it with your family members. Most community-based organizations, helpage is continuing, but still most of the NGOs and community-based organizations have closed physical operations and are identifying ways to serve clients through meal delivery services or through remote programming for welfare and healthcare access. So overall, if I may say so, elderly with chronic conditions need support through this pandemic. And secondly, not only elderly, attention should also be given to the caregivers of all elderly, with a special focus on immobile elderly who could be bedridden or they may be just completely confined to their next case. Right, so as far as Government of India is concerned, we had a five-pronged strategy. Initially, there was hardly any presentation as to what it is going to be like in India. But based on global reports, we knew a pattern that elderly are going to be forming quite a substantial amount of cases, as well as quite a substantial amount of mortality is also going to be among elderly. So the first initial five-pronged strategy which we had was, first and foremost, the biggest challenge of COVID-19 was not just the pandemic, but was the infodemic. By infodemic, I mean every platform, including social media, be it WhatsApp, be it Facebook, be it messages, be it news items, every single place, wherever you turn to, everybody and anybody was talking only about COVID-19. So you had various amount of sources to give you information regarding what is the disease like, what is the epidemiology like, what are the signs and symptoms, what you should do, what you should not do, to the extent that mistrust or myths and misconceptions have had a day galore as compared to actual scientific evidence. So if I'm an elderly, I am bombarded with so much of information that at the end of it, I am totally in a mistrustful situation as to who to believe and who not to believe. So the first thing Government of India focused was to provide scientific, factual, reliable, adaptable, and replicable information. So first and foremost, we have a lot of elderly awareness materials, which are including audio visuals, like you can see in the presentation. There is a lot of audiovisual material which has been hosted on the Ministry of Health and Family Welfare website. Secondly, in case you have a doubt regarding whatever message that you have received, either through WhatsApp or messages or through Facebook or through any other news items, so there are helpline numbers 23978046 and a toll-free number where 24 hours of the day there is somebody who is there to answer your queries. And if you are not comfortable to ask telephonically, you can even email it. And presently we do have a Twitter line also which has been started, in which you can get immediate response. Now, for specifically the psychosocial helpline, I'm sorry it doesn't show out here. There is a psychosocial helpline given by NMHANS. Number is available on the Ministry of Health and Family Welfare website and also in the NMHANS website, where you can call up and address any psychosocial queries that you have. Next. So overall, if you see, we have tried to create a platform where you will be able to get proper scientific evidence for preventing the spread of the disease and also what to do in case you get the disease. Under National Program for Healthcare of Elderly, a health advisory was put up about a month back, in which specific do's and don'ts pertaining to the health for elderly were put up. I'm not going to read it. I would request all of you to go up to the URL that is given at the bottom of it. NPHCE has a dedicated website which can be accessed, that is nphce.nhp.gov.in, and the Ministry of Health and Family Welfare website also regularly updates any advisories that are there. Next, please. Hello.
Dr. Gowri, can you hear us?
Yeah, I can hear you.
Yeah, we also can hear you. Please continue speaking.
Okay, I can't see my presentation. Somehow that is not being shown. So
can we have the concluding?
Of this,
can we have the concluding key messages from you, Dr. Gowri, in this case?
You'll have to give me a minute because this is just not showing.
Okay, we will get back to you.
Yeah, it's come back now. Okay, fine. So, okay. Can you hear me now?
Yes, we can hear you.
Yeah.
Yeah.
So, the next thing that I would like to state is the second strategy was the prevention strategy as well as for control. That was the role of mask, whether to use a mask, what is the kind of mask that you should use and what you should do and what you should not do. For elderly per se, our strategy has been, if you are venturing out of the house, definitely you have to wear a mask. If inside the house, wear a mask if you feel you are ill or if your family members are ill. And secondly, if possible, make your own mask. You don't need to go for an N95 or a surgical mask. The videos are there on the Ministry of Health and Family Welfare website. Next, please. So this is the link to it. I'm sure everybody can go through it. And it's a very great activity, which I've seen personally also. And it has been reported to be my colleagues also, that the children and the grandparents together are making their masks themselves in the house. Next, please. And this is the psychosocial advisory given by the NIMHANS, again on the Ministry of Health website, as well as on the NIMHANS website. I would request everybody to go through it. Next. Due to paucity of time, I'm just going through it as fast as possible. Specifically for surveillance and monitoring, the Arogya Setu app, which was designed, everybody has been requested to download it and register on it, and this will give you an idea as to whether you are likely or what is your likelihood of coming in contact with a patient or a contact of COVID-19. So elderly, definitely most of them have the mobiles, and even we do have those mobiles. So this is something which we have requested everybody, and the instructions have gone on to all the states of the country. Next, please. Next, please. Okay. Now, this is the COVID India Seva, the Twitter handle, which has been launched by the Ministry of Health and Family Welfare, where within 24 hours to 48 hours, any grievance redressal, even for treatment or for prevention or for any query addressing or anxieties on a daily basis, there is an army of people who are sitting out there. I know of 10 who are repeatedly answering close to 250 to 300 Twitter queries per day. Next, please. Next. Okay. The Ministry of Social Justice and Empowerment, which is the nodal agency for the welfare of senior citizens, has also come out with general advisory, not only for senior citizens at home, but also for those who are in institutions like old age homes, homes for dementia and Alzheimer's, etc. Next. Helpage India, Matthew Cherian has already stated, so I'm not going to go into the details, but yes, you will find scientific evidence on that website also. Next. Okay, so coming to my main task of providing key take-home messages. Now, at the national level, what we are bothered about is prevention and promotion of health as far as elderly is concerned, and controlling of the epidemic or the controlling of the pandemic of COVID-19 amongst elders, and from elders to the general population, or from general population to the elders. So first and foremost, stay at home. By stay at home, I mean not only during the lockdown. We are already aware that COVID is not just going to go out of the country after the lockdown opens. So this is here to stay, and along with COVID, there are other seasonal infections and diseases which are also going to be there. Elderly, by means of being immunocompromised or by means of having chronic illnesses, are much prone to that. So basically, when I say stay at home, what we mean is that you may or may not contract COVID, or you may have the ability to fight COVID, but if you are already exposed to some other infection, then you may have a bad progression in COVID, even if you contract it. So stay at home, avoid meeting visitors at home, and if alone, stay connected and develop some or the other kind of support, be it neighbors, be it support groups, be it residents' welfare associations, or even your local police thana. Secondly, personal hygiene has already been stressed. Hand hygiene, wash your hands and face at regular intervals with soap and water. And where water is a scarcity, please use a sanitizer. But again, I'd like to say elderly with dryness issues, it is best to wash hands with soap and water. Thirdly, daily medications must continue. You must not change your routine medication, and you should ensure that you have regular supplies of these daily medications, whatever be it for hypertension or diabetes. Fourthly, nutritious diet has already been talked about. My focus basically is on fresh home-cooked hot meals if possible. Hydrate frequently. Don't try new immunity boosters. There are a lot of issues and a lot of advisories going on various things to be tried to improve immunity. You have to understand that immunity cannot be developed within 2 days, 5 days, 1 week, 1 month. It is a very long drawn process. So yes, like my earlier speaker had stressed, go for a nutritious diet, include certain things if you feel that it is okay, but please do not try any new immunity boosting medicines, specifically the ones which are being rotated on the WhatsApp messages and on other platforms. Exercise minimum 30 to 45 minutes per day based on your capacity, which should be mild to moderate exercise. Don't tire yourself out. Exercise has proved to improve immunity in the long run. And make sure that you do breathing exercises, resistance or balance exercises. Just stand holding the doorknob for 5 minutes on one leg, change your leg and stand for 5 minutes on the other leg. That's more than sufficient if you can do. Resistance exercises can be done with even your water bottles, or with the salt bags, or with anything that you find at home. So make sure you do any kind of exercise that you feel comfortable with. Physical distancing. Social distancing has been very badly mislabeled. It's basically physical distancing from anyone. By anyone, I mean even family members who is ill. By illness, it could be any kind of thing from sniffles to fever to any kind of thing. If somebody is ill in your family or outside the family, please do not go near them. Secondly, wear a reusable mask, and if possible, make it yourself. It'll give you a nice activity to do, and plus you'll be very proud to make a mask for yourself and wash it frequently. Infodemic awareness, please hear, say, and see positive news only, and make sure that it is from reliable sources only. Share your fears and illness symptoms. Anything unusual that you feel, because for elders, they themselves are the best people to identify what is wrong with them and what is not wrong with them. So if you feel that you're not comfortable, it could be just a feeling of uneasiness or maybe lack of appetite or just dizziness, please do share it with your family members or any other support group or health worker in case you're living alone. And if you develop fever, cough, or breathing difficulty, definitely contact a healthcare worker or ask somebody to contact a healthcare worker nearest to your place of residence. And skill yourself, specifically with the various apps and everything that is there on the mobile. It will help you to keep yourself in touch with your loved ones, give you information, and also take your time. Next, please. And lastly, next, please. Lastly, the messages for caregivers. You are one of the most important resources that an elder has. Whether you're a family member or whether you're a professional caregiver, make sure that these 5 things are at the topmost of your mind. Firstly, address the basic needs. Make sure that you have stable meals. If it is not possible for you to provide fresh meals, make sure that you make things and keep properly in the fridge or outside for yourself as well as for your elders. There should be access to medication, at least for about 10 days. Medication should be available with you so that you may not need to venture out, and make sure you have mechanisms for keeping the stock of medicines. Healthcare access should also be there with you. You should have some numbers or something or somebody identified to whom you can contact. Don't ignore any unusual or abnormal symptoms in yourself or in the elderly also. So make sure that anything that is out of ordinary, suppose you are catering to a stroke patient, anything other than ordinary which you see normally in that patient, make sure that you identify, discuss it with some healthcare worker or with somebody in the family. Identify ways to stay in touch in case you are identified COVID-19, or even if you're not identified COVID-19, even in self-isolation, please do stay in touch in form of video conferencing or in the form of talking to somebody on the phone. Other than your patient, take care of your own hygiene and health. Wear a mask definitely while attending to the elderly patient. You have to take care that you do not develop any infection which you may inadvertently pass to the elderly patient, and also that you do not contract any infection from the elderly patient. So make sure that you use a mask, wash your hands frequently and properly, like it has been stated in various platforms, for 20 to 30 seconds and the various modalities that are there. And most importantly, take regular breaks if you're caring for an immobile or bedridden elderly, and indulge in activities which really soothe you, because your mental peace is the only thing that can help you take care of yourself as well as of your elderly. So I hope these key home messages for both elderly as well as for caregivers will help in shedding some light on how to go about in the near future for COVID-19. Government of India is committed through the program to provide various services. We are in the process. Our perspective for the coming months is going to identify the needs of the elderly in the field, provision of geriatric care services in the form of OPD, inpatient wards, lab services, through the various mechanisms, that is district hospitals, CHCs, and primary healthcare centers. Evaluating the system requirements, we've already prepared empowered groups which are going to assess whether drugs are in proper availability in all the states, whether consumables are available at all the medical institutions, and also to mobilize the healthcare workers and sensitize them regarding the needs of the elderly, specifically for medicines, identification of suspect cases, and health education to allay the anxiety of developing COVID-19. Thank you very much.